Essence basically is you can live well beyond breast cancer if you understand what makes the difference between doing it well and not doing it well. The fish bowl is going to do all our lunch today. I understand, very interesting lunch.
Good afternoon, Lily. I'm glad to represent the Fishbowl to interview you during the Women's Health Forum event. Maybe you can introduce yourself first to our audience.
Thank you, Jocelyn. I'm Yong Lee Lee, founder and honorary CEO of Pink Ribbon Wellness Foundation. Thank you for supporting us, Fishbowl, especially Jocelyn. Have been working with her for the last few months. Thank you so much, Fishbowl, for supporting our event and Pink Ribbon.
Can you provide the mission of Pink Ribbon Wellness L Foundation?
Pink Ribbon Wellness Foundation was established in 2012. 11 years ago, our mission is to empower women and to educate women on breast health care and also supporting breast cancer survivor. So we have been in this journey for 11 years already.
May I know what inspired you to become and involved in the breast cancer field and lead to this foundation?
I'm a breast cancer survivor for 18 years. I was first diagnosed in early 2006, almost 18 years ago. So surviving 16 years helped me through this journey. It's because of my involvement in Pink Ribbon that's helped me in surviving this cancer for 16 years. However, 2 years ago, I was diagnosed with recurrence, and thank God it's also early stage. So if you are diagnosed early with breast cancer, the survival rate is almost 100%.
What are the biggest challenge during all the year when you are doing this foundation and how you overcome it?
In the foundation, because we wanted to educate more women, so we have been moving around Malaysia to educate women community. The challenge is to get them coming out to attend our event for us to educate them. So we need to really work with the breast cancer support group in various states and to collaborate with them to educate the rural folks on breast cancer awareness. So I really hope that we are able to reach out to more women.
Good afternoon, Datuk Dr Devanand. Can you introduce yourself as a role in the Pink Ribbon Foundation?
Yes, my name is Dr. Dave. I'm a breast surgeon by function, but basically I'm also the founder and chairman of the Pink Ribbon Wellness Foundation. And the element about this is to help breast cancer patients understand better about their disease and probably to improve their survival after the diagnosis.
May I know what is the role and specialization as the consultant breast surgeon in the Pink Ribbon Foundation?
My role basically is to be able to educate women. Also, as a surgeon, we understand the subject better. But as a Pink Ribbon Wellness Foundation, our role basically is to keep on making people understand about the importance of early detection and, if possible, even prevent breast cancer. After diagnosis, we would want patients to be able to live well beyond breast cancer. So making them understand the importance of nutrition, exercise, putting on too much weight, and so on and so forth, having proper medication, and probably appropriate diet and supplementation. Obesity now is on the increase, especially among women. Almost 49% of our women are overweight. If they can bring your weight down, then they can survive cancer better. If not, basically the cancer recurrence will be reduced and cancer death related will be reduced.
Is the weight the main issue that we need to concern on it?
Yes, across the board now, obesity has increased tremendously across the world. Now, obesity increases your risk of cancer, whether cancer of the breast or cancer of all the other systems. There are almost 14 different cancers in women related to obesity alone. So if obesity is an important factor in cancer cause, we should find a way to reduce obesity, having proper diet, balanced nutrition, just as much as what you have here at Fishbowl. The idea here is balanced nutrition will bring the risk down. Even if you have cancer, you can reduce the risk of cancer recurrence.
what is the best recommended screening method for all of us?
I suppose the best method of trying to screen basically is to do your own breast examination. So we recommend young women at the age of 20 onwards to start doing their own breast examination every month. If you're already after menopause, then you can do at any one time in a month. You can examine. The idea is to understand your breast, look at your breast and look for any kind of abnormalities. Appreciate the breast that you have in terms of the character of the breast itself. The moment there's a change, you may not make a diagnosis, but at least you can tell the doctor, look, I think there's something different in my breast, and probably look out if there's any lumps, any kind of discharge from the nipple and so on. So the best screening method advocated, which is free of charge, because you can do your own breast examination very easily every month after your period. But in the event you need any help from the doctors, the doctor may recommend that you have an ultrasound of the breast. Now this is a sonogram without radiation. You can see in case of lumps, water bags, solid lumps and so on and so forth. So the idea of ultrasound, because it's non-radiation based, is for women under the age of 40. But the moment you cross 40, the better method, which is the gold standard today, is to do a mammogram. And a good mammogram facility can help detect cancer as small as 1 millimeter, 2 millimeters, 5 millimeters and so on. And we recommend mammogram to be done every year from the age of 40 to 49. And after the age of 50, you can do every 2 years, which if you have a family history, then you may have to do mammogram every year, plus or minus an MRI of the breast.
We would like to ask for the last question, and this is quite meaningful. What are some success story and memorable moments that you experienced during your work life in the foundation or during your career?
The most important thing that we have, or rather I have learned basically, there are many women who still lack the information and the knowledge about breast cancer, how to examine the breast. There's a big vacuum in this country. Even as we speak, a lot of women are still coming in late stages of breast cancer. That means lack of knowledge, fear, worry about the breast cancer may cause death and so on and so forth. Being negative doesn't carry you too well. Being positive, you can even survive. So it's very important that our success story is not from treating alone. It's also about caring for the patient, support from the family, from the system that we have, support from Pink Ribbon Wellness Foundation as we go along. And of course, in this case, even support from Fishbowl to make sure our patients at this forum is being taken care of. So our success story comes from our passion to do the job for all the cancer survivors.
Okay, thank you, doctor.
Thank you.
So we really thank and glad for having this kind of foundation to educate all of us, especially women and ladies, because this is really important, and maybe some of them don't have this knowledge as well. So we are very glad the Fishbowl have the chance to support for this event as one of the sponsorship and provide such a great Pokeball to all of you.
Thank you.
Yeah,
I
thank
hope
you,
we can
Lily.
continue our collaboration for the future.